So today at this remarkable Agile conference, I feel truly proud to be a part of this event. I'm Rahman, and I'm talking about AI-driven prescription assistant, transforming impact in patient care with generative AI and Agile delivery. I would like to start with a story of a patient. Uh, it was taken from 16th September 2023 at the Devonport in Tasmania in Australia. So this story is connected with an experience of the reality. One night, a patient experienced a rectal bleeding and decided to go to hospital. And after arrival at his hospital, a high level of urea found his blood according to his test report. That is a clear sign that internal bleeding could be happening at any moment. Despite of this, he was sent home for with a medication for hemorrhoids and advised him come back to a regular checkup after 2 weeks later. Sadly, he never made it back. The same day, he passed away due to a severe arterial bleed that is caused by a duodenal ulcer. According to the forensic pathologist, had the patient kept under the hospital observation, his life could have been saved. Why I'm telling you this story here? Because it highlights something meaningful, something serious. Even with the best doctors, best treatments, best intentions, human errors under pressure can be distressed anytime. But the story could have been like an AI assistant spotting the blood result and warns the team, wait, don't discharge this patient yet. But that was not happened that day. But the story could have been like an AI assistant is there, then the doctor can get a better decision or give the patient a better medication. This journey I am here to share with you today how AI and Agile delivery together can transform patient safety and even save lives. Let's connect to the story or the reality to the everyday challenges inside our hospitals. The patient was just, I mentioned, that was not failed, but, and that was not failed by a single doctor, it was a system failure. And when we look closely, there are 4 big cracks we can see. First, the manual prescription process. Even today in many hospitals, prescriptions are frequently handwritten or manually entered. This makes them upon human errors, and there is a chance to create a mistake, and that can delay critical treatment. Second, limited decision support. In high-pressure environment in our hospitals, like ICU, operation theater, or busy wards, doctors have to take in life and death decision with incomplete or fragmented data. They don't always have a complete dashboard, giving them a real-time and comprehensive patient view. And third, fragmented systems. Sometimes hospitals run on multiple silos like electronic medical records, hospital information system, laboratory information system, pharmacy, and all operating systems we found run separately. When systems don't talk to each other, the patient story can be broken into many pieces. And without the whole story, it is really very complicated to see the real risks in a time. And finally, doctor dependency. Most of the times we rely in individual doctor. If the preferred specialist is not available on time, then the treatment can be delayed. The impact is very significant on this scenario. That is, patients drops into high risks anytime they lose their lives unnecessarily, and care teams and the clinical teams bear an ever-growing burden under immense pressure. And this is exactly the gap where AI and agile delivery can bring transforms for the patient safety and thus saves lives. Now, keep in mind those challenges in mind. We can view a vision for an AI-driven prescription assistant. This is not about replacing the doctor and their empathy, emotion, and loving care. It's about helping them for a kind of supervision. The first vision this vision has three core pillars. First, intelligent recommendation. Instead of depending on memory or incomplete charts or data, whatever you can say, the system reads a patient full medical record in real time and suggests a safest and most effective options. It also warns about risk-drug interaction and giving personalized advice for each patient. And second, we can see seamless integration. Instead of scattered system, our solution connects with all hospitals' operating units and brings all data into one unified view. Doctors can get complete patient history faster, clear, and reliably, so they can make better decisions quickly. And then third, enhanced, and third, evidence-based support. The assistant draws from vast clinical knowledge, journals, and research, giving doctors fast, safe, and evidence-based suggestions. It's like having the world's largest medical library at fingerprints, helping them revise with confidence and accuracy. Our goal is improved speed, safety, and support in patient care. We are not replacing doctors, but enhancing their judgment. This assistant acts as a co-pilot, you can say, helping prevent errors and ensuring every patient receives the best care. So now it might be asking, how does this all actually work? The answer is the power behind the system is generative AI. It's the engine that makes the intelligent recommendations and seamless integration as well. Let me break down the 4 key stages of how this works. First, we see patient data analysis. The assistant analyzes all patient information, their history, vitals record, and lab results together, creating a complete view to make safe and effective recommendations. And second, drug and doses. Drug and dosage suggestions. Based on the full analysis, the AI recommends the right medication and exact doses, acting like first precise medical expert, checking thousands of data points instantly. Number three, assistant prescription draft. The system turns recommendation into a full prescription in a second, reducing the human error and freeing doctors to focus more on patients. Number four, continuous learning. The system keeps learning from past cases, new research, and update guidelines, becoming more smarter and more reliable over time to provide better support as well. The system is powered by LLMs. It is used for understanding language, and for communication we use NLP, and clinical ontology for medical knowledge, and up-to-date medical guidelines for safety and accuracy, making healthier, smart, and safer. So all these we have done. So there may be a question: what is the outcome of this system that we work for? First, it enhanced accuracy. The system reduces human errors, and by analyzing all patients' data to ensure the right medication and doses. Second, improved efficiency. By using this solution, doctors can review and approve recommendations quickly, seeing more patients at the time and focusing more on critical care rather than the paperwork. And third, reduced cognitive load. It's very important for the doctors. In our systems, the system is nothing but an intelligent co-pilot, and the system synthesis data and detects and highlights potential risks, letting clinical staff to concentrate on patient interaction and high-level clinical decision. Finally, greater patient safety by minimizing errors and easing cognitive load. It helps to lower the risks and adverse drug events, creating a vital safety net. This doesn't replace doctors' expertise. It helps them with a tool to make patient care safer, more accurate, more effective, more efficient, and more successful. So we talk about the outcomes, but how we measure these outcomes? We have already talked about the why and how this solution works. However, the true power of any vision to exposed when it ultimately returns tangible and measurable outcomes. Once we implement this AI-driven solution, Agile build solution, the outcome speaks for itself. First, we see a 30% reduction in medication error. This is not just a number. This is the profound impact on patient safety. A 30% reduction means what? Means fewer adverse drug events, fewer complications, and ultimately a safer journey for every patient under care. This is the direct result of having an intelligent system as a safety net. And then we achieved a 20% of improved workflow efficiency by streaming clinical processes and automating routine tasks. We free up our clinical teams. This 20% improvement means less time spent on manual administrative work and more time to direct patient interaction and care the patient with their empathy. And perhaps most importantly, we reduced we recorded 88% of clinical adoption rate. This figure is a testament to the fact that this solution works and it is trusted by the professionals who use it. When clinicians realize that a system makes them more effective, reduce their cognitive load, and helping them provide safer patient care, they just embrace it without any confusion, any hesitation. This helps adoption rate, this high rates, adoption rate highlights what highlights their satisfaction and a deep sense of trust to the technology. These numbers of demonstrations that the combination of AI and Agile is not just a theory, it's a proven model for building a future where technology empowers our doctors, enhances patient safety, and creates more significant, more efficient, and more healthy healthcare system. So after this, just talk about the initial results, but uh, how it works, our work doesn't stop there. The agile mindset of continuous interaction and with the iteration is built into the very core of this solution. We don't just release this solution as product. We walk away and constantly refine it time to time based on the real world uses and feedback. This continuous improvement cycle focus on three key areas to ensure the real-time uh, this focus on the key areas to ensure the tool remaining a perfect match for complex clinical needs. First, we continuously refine the dosage logic. As we gather more patient data, our engineers and clinical experts work together to make doses recommendation increasingly accurate and precise. This ongoing improvement ensures the highest level of patient safety as well. Second, we focus on the user interface. That is very important. We are constantly making the design more natural and clinical friendly. We know that no matter the system is how powerful, it is a complex system will never be used. We conduct feedback session with doctors and nurses by prototyping to ensure the platform that feels seamless, reducing their cognitive burden and listening them to interact with the system and ease. This is the core implement and that driving the high adoption rate. Finally, we enhance the alert system, and this is very important features and for the doctor to that these are the robust. This alert system is a robust and timely warnings for potential drugs interactions or clinical health events. New drugs come when a new drugs come to the market or a new combination are introduced. Time to time, we update our alert algorithms to provide proactive warnings, and that can prevent a life-threatening solution and situations as well. This ongoing work is directly tied to our mission of increasing patient safety. This dedication to continuous improvement is how we ensure that our assistant remains dynamic, relevant, and also trusted partner for the healthcare professionals, directly contributing to the right and directly contributing and to the fight against doctors' burden and elevating the standard care through the clinical excellence as well. So, Agile in Horizon, new. So, Agile in healthcare, it's a new horizon of innovation, you can say. We have talked about the power of AI and measurable outcomes of our work, but great technology and great results that build upon a solid foundation. The foundation is just nothing. It's Agile methodology. We traditionally rooted in software development, as we all know that Agile offers and transformative approaches to clinical innovation. It is the how we build, iterate, and improve the process to meet the dynamic needs of a healthcare environment. First, we talk about adaptability. Agile permits to respond quickly to evolving clinical needs and patient care requirements. The world of medication is constantly changing with new data and new challenges developing every day. Second, efficiency by streamlining our processes into short, we significantly reduce the time it takes to bring clinical healthcare solution to the frontliners. And finally, collaboration. This is the heart of our success. Agile fosters deep synergy between our technology experts and the medical professionals. We work together side by side, sharing feedback and insights daily. Now let's talk about how we build this system. Our Agile approach turned an idea into real impact, complex clinical settings. So we have talked about cross-functional team. That team was not just developers team based, and that was very beginning. We introduced doctors, developers, AI trainers, testers, QA experts, and technical writers working together. And rapid iteration model, we worked a short sprint and did user story grooming directly with the physicians. And the system that we work was supported by a robust CI/CD pipeline. We use Jira for project management, Git and version control, and Jenkins for continuous integration and delivery. And finally, then this all leads to the development of an early MVP, and we don't wait to build a perfect, all-inclusive solution. This enables us to get rapid feedback from the frontliners. Now let's talk about the core pillars that makes all AI-based prescription solutions powerful, especially in clinical settings. This is, of course, patient-centric, then collaborative teams, continuous improvement, and adapting plannings. These four pillars are why Agile is not these four pillars here we see that is not just a project management tool, it's a mindset that allows us to deliver continuous improvement increment values that can truly enhance patient care. So we have some key lessons that we earned during our project. We all as you have seen, our approach was guided as structured process. Our project key difference lies in the lesson learned, and that is vital insights for applying Agile in complex healthcare. We saw the value of physician product owners. Doctors provide crucial clinical insights, and with a Scrum Master guiding Agile processes. Structured conflict resolution in hospitals' high-pressure environment. Scrum ceremonies helped us resolve conflicts and prioritize urgent needs while keeping the team team cohesive, and building logical gaps. Clear documentation helped to translate complex clinical requirements into technical specification, ensure smooth communication between medical and IT teams. So key takeaway, we have covered a lot of ground today. So we began that tragic story, explored the challenges in healthcare and the outline in a vision. For the future, we continued. I want to leave you with our 4 key take for, sorry, takeaways. That is medical catalyst, doctor empowerment, agile delivery, healthcare innovation. And so now we talk about scalability and future roadmap of this system. First, we innovation border application, that assistant we built and in patient care that can be extended to other clinical areas. And multi-language support, we served is to serve this population, we are planning to integrate multiple language support in the system. API-ready integration in order to create a platform that can make integrate with the national health data platforms. And finally, our commitment to adaptive AI. And the AI will continue to learn and adapt to different care protocols, whether in rural clinic or large urban hospital or specialized care settings. This roadmap is a testament to our belief that technology, when built with a purpose, we create a more efficient, equitable, and life-saving healthcare systems for everyone. So, last key takeaways, we have covered a lot of ground today, and I want to leave you with 4 key takeaways just at a glance. And this is about medical catalyst. Generative AI is not just a tool, it is actively transforming patient care, making it safer and more efficient. And doctor empowerment, this technology is designed to enhance doctors' capabilities without ever replacing their clinical role or their replacement human judgment. And we have built a co-pilot, not a replacement. Agile delivery, our agile delivery model proves that a particular, practical, and secure, robust offer life-saving solutions. And finally, the project represents a blueprint for healthcare innovation. This model we have created is replicable and high significant potential for healthcare innovation across this subcontinent and as well as global challenges. So we have now reached the end of our journey, and I want to thank you all of your time and attention. It's been a privilege to share this vision with you. So thank you all. Last, I wish all for you that may the rest of your life be the best time of your life. Thank you.
Thank you, Mohammad. If we have any question, we can connect.